The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle, and we have another great program for you as always, and we're going to kind of dig deeper into your immunological reactions and why Sprung has exacerbated so many different conditions for you, including Sjogren's and lupus and rheumatoid arthritis. And it's awful. There's so many people that are suffering right now, and you would think it'd just be a stuffy nose and allergic reactions and that coughing and sneezing and so forth, but it's really far more than that. And that's what I really want you to understand. I want you to get that there's things that are taking place that you have been putting off for a long, long time, and it's starting to bite you. And we're going to talk about those in depth and make sure that you have the tools. And I want to remind you that this is 2 weeks from now. Then coming up on the 15th at the Roselle Center for Healing in Fairfax, Virginia, Dr. Stephanie Pina and I. Stephanie is a doctor of naturopathic medicine, extremely capable, very able physician. And we're going to get into not only springtime allergens and what you can do about it, but more importantly, why your immune system is not working the way it's supposed to, why it's faltering, what are the mechanisms, what you can do about it. In today's episode, today's program, we're going to be talking about why other conditions are starting to show up as well. What we're talking about. We're talking about rheumatoid conditions. Your joints are screaming, they're swollen. You're seeing this problem with your eyes that go along with perhaps even a lupus condition, a Sjogren's pattern, which is one of the worst autoimmune conditions that there is, particularly if you're dealing with a Zika pattern. Zika means that the organ systems are beginning to shut down. And all of a sudden, the spring is like the worst time of the year for you. Why? Why is that? Well, we're going to talk about that quite a bit today. But on the 15th, we're really going to get into it. I'd love to have you there as my guest. I'd love to meet you. All you got to do to make it happen is go to drtomroselle.com or rosellecare.com. And by the way, if you have a question and you find that you can't make that class, if you go to rosellecare.com and you go to the top of the website, there's a way to you to talk to one of our doctors with absolutely no obligation whatsoever. It's a free 20-minute consultation with one of our great people. And they will answer your questions. They'll tell you what their opinion is. And you have no obligation. It's just a conversation. You're welcome to do that at any time. 703-698-7117, 703-698-7117. And ask your questions. But more importantly, why don't you join us? Join us on the 15th. And I promise you're going to have more data. But I'm going to finger point. I'm going to say, listen, this is what takes place. This is why you're suffering. This is what you can do about it. And you'll have the opportunity. Remember what I always say, this is not a timeshare sales anything, because we're not going to sit you down and say, you got to do this, you got to do this, you got to do the other thing. No, you're going to get a ton of data, and then you get to apply it. You get to do what you need to do with it. Okay. So enjoy it and get the information and make it happen. Let's get into the program and let's talk about these autoimmune conditions that kind of show up as a result of the springtime shift. And by the way, this will apply to the fall allergy season as well. But your immune system, the suppression, if you will, is a result of your inability to handle certain incoming. We'll put it that way. It's easy for all of us to remember that way. So all the molds and the funguses and the pollens and, those kind of things, there's a shift in even environmental atmospheric conditions. That autoimmunity, that reaction includes everything from infections to joint space deterioration. Take a look at your skin and you're all broken out and you can't understand why it's there. It's really important that you understand the variations in the seasons and what they can predispose you to. Now, I'll give you a very simple piece of the puzzle, right? Vitamin D levels, which you've heard me browbeat about repetitively over and over and over again. It's a major problem. There's a guy by the name of, Schofield, Uta Schofield, that brought this out in exploitative terms over a period of many years. And so what we see in the late winter months or in the early spring, correlations to tremendous increase of symptoms that are related to things like MS and all kinds of arthritic deteriorations. Now, here's the other piece that you wouldn't think about. Your melatonin levels that are produced in your pineal gland are the lowest in the springtime. And that's because of the crazy winter changes and the time shifts and so forth. And we're finding that it correlates very, very dramatically, specifically to exacerbations in MS patients, multiple sclerosis. So if that's the case, with something as simple as making sure your vitamin D levels are high and taking a significant amount of melatonin, not just a little bit, but quite a bit of it, would that make a difference in MS patients? Our clinical observations over 5 decades of treating patients shows that these people often will have dramatic shifts and changes in how their body responds. So we're going to go through a little bit of that today. We're going to talk about what happens with systemic lupus. We're going to talk about psoriatic arthritis. We're going to talk about rheumatoid, but how they all relate kind of one to the other. Even something called Epstein-Barr virus. Dramatic increased incidence of Epstein-Barr occurs in the springtime. And it's associated with those things that we just talked about, lupus and SLE and so forth, and Sjogren's and the like. So if that's the case, if that's Epstein-Barr is one of the primary prime movers, it's a virus. And by the way, Epstein-Barr also is one of the 6 different types of herpes. And you have multiple pieces, not just, the herpes on your mouth, not just the genitalia herpes, but they got 6 different pieces of herpetic infection. And this is one of them. You say, oh my God. Well, yeah. So, and then what we see is we see higher rates of diabetes, particularly the onsets of even type 1 diabetic patterns and so forth. So am I making you nervous? I'm not trying to make you go, oh my God. I'm trying to get you to understand that if I bring it out, there's ways of modifying, resolving without having to use drugs, without having to suppress your immune system. Because if you realize right now, if you watch the news, every drug that you see out there today is a result of an immunological suppressive drug. They're biologicals. It's not okay. But let's get into a couple of the pieces, and we'll do it more specifically as it goes through. But the association between seasonal factors, if you will, there are springtime allergy reactions, all the increase in symptoms. My nose is running all the time. My head feels like it's going to explode. I have this throat. I can't clear it. I walk into a beautiful day and all of a sudden I feel worse. Well, let's find out why it happens. And let's talk a little bit about MS since we brought it up. And there's, people say, oh my God, I don't want to have to deal with MS. Well, MS is a chronic inflammatory disease or reaction, and it affects the central nervous system, the brain, spinal cord, all the way through. That's your central system. And it's a progressive problem. It relapses and causes neurological shutdown. We'll call it disability. And it's due to the covering. If one of those of you are watching, you look at my sweater, visualize this as the covering, the myelin sheath that drops down around the spinal cord. And what happens is it causes it to break down. It causes it to, they call it demyelination. It dissolves itself. We'll use that. It's not really that, but I'll give you an understanding of what it is. So there's so many environmental factors that seem to be related to it. And there's things that have been suggested, even the month of your birth, which is like crazy. I don't know if we're looking in the stars for that one, but definitely vitamin D levels, smoking, and viral infections of all kinds. We know that MS is significantly related to Epstein-Barr. There's a lot of research out there that finger points that way. So when you're looking at MS, you have to make sure that you begin to look through the weeds and say, do I do this? Did I do this over a period of time? What things that have I been exposed to? Then we also have to look at the exposure to mercury and other heavy metals. There was a program that I watched many years ago, and it was one that was the initiating step of a guy by the name of Dr. Richard Fisher, who I have tremendous respect for. He's retired now. He's a dentist. He was one of the first that presented to Congress the problem with mercury toxicity due to tooth fillings and how it affected the nervous system. And he showed these nerves exposed to mercury and how they immediately began to entangle themselves like this web that had no intention or no intelligence to it. So if that's the case, you got to be careful, right? The exposure. So where do we get mercury? We get mercury from old fillings. They go into your body. We get mercury from the adjuvants. Adjuvant is a stabilizer that they put in the vaccines, and that along with aluminum, and they can cause very significant problems. So if that's the case, is there a way of finding that out? Yes, there is. There's many ways of finding out. There's very specific testing that can be done on an ongoing basis. So look, here's the deal. If environmental factors can influence disease activity in patients, other than just a runny nose and cough and so forth, could it be the triggering mechanisms, along with other things, that are making your multiple sclerosis, your immune system, your intestinal problems to become worse? Well, I'm here to tell you absolutely 100% yes. So if you go into PubMed, which is one of my favorite resources because there's tons of articles, both pros and cons, you're going to see that many patients, particularly the MS patient we're talking about, have huge numbers of relapses until it goes down. So they get better, they get worse. They get better, they get worse. They get better, they get worse. But that worse gets worse and worse and worse and worse and worse. And often as a result of initiators that are environmentally. So if we're doing that, my friends, wouldn't it be great to figure out if, in fact, that we can turn around, resolve, make better by treating some of the underlying situations? Like what? Well, it's like your fight-flight system, like your adrenal system. You know, it produces your steroids. It also kicks in your immunological reactions and so forth, making sure your gut, your microbiome is clear. You don't have a leaky gut in there, and that you have good bacteria, lots and lots of it. Make sure your digestive system itself, your stomach, you got enough hydrochloric acid and gastrin and pepsin and so forth. Do you know that if you don't have good digestive processes in your body, that all these incoming, these molds, these funguses, these viruses and so forth, just set up housekeeping. There's nothing to stop them. That's your first line of defense. It's number one. So let's figure out how to make that happen. As I go through the program today, I'm going to give you some hints of what to do and how to make things go away the best way. Look, if you want to help yourself, you have all the tools available to you. It's called your body, your physiological element called you, but you got to support it. You got to know what to do with it. You can't buy into Fifth Avenue marketing and drink the sodas and sugars and all the nonsense that we talk about on an ongoing basis, because you're just kicking yourself in the butt. Did you know 1 teaspoon of sugar or something like sugar decreases your white blood cell response, by 8 to 12% for 8 hours? So guess what happens? If it goes to sleep and you keep compounding it, no wonder we're sensitive and we pick up everything that comes down the pike. So I don't know about you, but you know, we're going to talk a little bit today about why you go out in the springtime. And in the springtime, you end up with more twists and tears in your ligaments and your joint spaces and your muscles and so forth than any other time of the year. A lot of you say, well, you know, guess what happens? No, it's not just because you've been sleeping all winter, although that's part of it. But here's the deal. It's because your immunological system has not been supported. The vitamin D levels drop down. You've been eating all kinds of garbage in the winter months. You've been drinking too much because you're depressed. You're taking medications on an ongoing basis. You have that SAD disorder. All of these things contribute to why your immune system has a problem and you can't seem to get out of it. Look, there's a tremendous amount of studies out there that provide huge finger pointing that says that your environment is the primary trigger of all kinds of neurological degenerative conditions. So if that's the case, do you really think that you're living well? Do you think that you're not culpable in this silliness? I don't know about you, but the short answer is, yeah, I think you are. So how about looking at something as silly that you wouldn't have thought about? How about the ambient sunlight? Does that have anything to do with anything? Well, according to an article that was published some years back, and it was a host of scientists that were involved in this thing, and they said that monthly ambient sunlight causes infections and relapse rates extremely high in particularly what? Multiple sclerosis patients or MS patients. Now, if that's the deal, so why don't we deal with it? Why don't we look at it more specifically? Why don't we, say, is vitamin D really a problem? And you go to your doc and say, oh, don't take any more than 500 milligrams a day because it's going to cause a problem. There's no studies out there that show that, by the way. And a lot of patients need to go on in many research studies up to 100,000 units of vitamin D a day and stay on it without any side effects. But at least getting that vitamin D level on a normal blood test that says from 30 to 100 is normal. I don't know about anybody else, but I want my patients up to about 90, 95. It's important that they maintain that because it's a primary contributor to immunological support. So we've touched on a lot of the little things right now, but as we get into the program, we're going to talk about why your body's breaking down, why you're having the symptoms, why your joints hurt, why you have the swelling in your hands, why you seem to be getting hurt, and your body just said, oh my God, it's not okay. We'll talk a little bit about, the triggering mechanisms that are underlying all this. And I hope you take this seriously, but please mark your calendars. Mark your calendars. I want you to join us on the 15th at the Roselle Center for Healing in Fairfax, 6 p.m. It's clean outside, meaning fresh air, it's not, light longer. You'll go home in the light. Join us because we're going to get into the nitty gritty and I'm going to show you how to fix this, how to make a difference. If you're willing, if you want to make a difference. If you don't want to make a difference, then you got to live with your ugliness, right? But I got to try to figure out how to keep on keeping on. And so I can do all the things that I want to. One of them is keeping my airways open to you so you can do what's necessary. Look, if there's a way to fix something without drugs, without surgery, without being contributory to the ka-ching in the pocketbook of the drug companies, yes, I said that. Absolutely, because that's part of the biggest part of the problem that we see out there, because your body's getting kicked in the tush. We'll touch upon that a little bit later on in the program, so make sure you stay with us. Look, here's the deal. There's so much that you can do to make a difference. Why suffer? You think it's just about that runny nose? You think about it's just about that cough that you get, that difficult breathing when you're walking down the street? It's a lot more than that. It's your immune system that's getting its tush kicked, my friends, and it's going to cause all kinds of other problems, even predisposing your intestinal tract to things that you don't want to think about. And we'll talk about that unidentified terminology later on in the program. So you got to stay with me for a while, right? And I'm going to give you some things that you can do to make a difference. We're coming up to a break, and I want you to stay tuned. Don't go away. Stay with me. I'm going to give you so much data today that you're going to say, oh my God, what do I do with this? Well, that's why you're going to come and join me on the 15th. You're listening to Ageless Health with yours truly, Dr. Tom. I'll be right back. Don't go anywhere. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody, welcome back. This is Dr. Tom. You're listening to Ageless Health. And, why don't we name it Ageless Health? Did you ever think about that? There's a lot of things that I do. It's like my book was, Ageless Health. Health is a do-it-yourself program. We have a program that we do for the public. It's called Ageless Health. We do this radio program called Ageless Health. It's because your health should not be dependent on how the clock goes and the months go by and the years go by and so forth. And if you really understand that and you own it, then you should come into this world like a ball of fire, live strong and well. And then when your days are over, you should just it's done. Your time clock's finished. But how many of us sputter and stop and spit and slide and so forth? And it's a downward roller coaster ride. It's not the way it's supposed to be. So let's get back into the program. And I want you to think about that. We're going to talk about something initially in this segment called mast cell activation. Now, you'll excuse me while I get a little bit of throat pack here because I've been talking too much this morning, doing a lot of pre-recording. But mast cell activation syndrome, many of you have heard that, and it's the most overused diagnosis, if you will, by the medical profession, my opinion, right now, because they don't know what else to do it. Is there a mast cell? Yes. Mast cell is a primary immune situation that is supposed to protect you. But when it gets out of hand, it can mimic all kinds of things. Supposedly it mimics allergy reactions, and it can cause recurring anaphylaxis-like symptoms and hives and swelling and wheezing and even irritable bowel syndrome and diarrhea. So if that's the case, wow, the question then becomes, why? Why is it doing that? When a mast cell actually is something that is set into process to, if you will, protect you. Okay. So, but it's not doing the job of protection. So a mast cell activation syndrome is usually is a response to external allergen reactions. That's why in the springtime that you get more of this. And it's in an inappropriate activation. It shouldn't go overwrought. It shouldn't go over the top. But it's often due to aberrant signaling within the body. It's not working the way it's supposed to. So the problem can show like all kinds of rashing on the skin. It can be a result of the gastrointestinal system not working the way it's supposed to. Remember, I've said repetitively that the intestinal system is about 75% of your immune system. So if the gut's not working, if there's a leaky gut pattern and so forth, then you get things like eosinophilia esophagitis. That's when the eosinophils, which is a type of white blood cell, causes the throat to swell, makes breathing difficult, gives you asthma-like reactions and so forth. Now, you can resolve these things, but you have to know what you're dealing with. And it's not just take this to suppress the symptom. Unfortunately, if you keep taking things that suppress immunological reactions, other disorders start showing up. Your MS conditions, your rheumatoid arthritis, your Sjogren's, your lupus, and so forth. So what do we do about this? How do we understand that mast cell activation, number one, is a very rare thing, but they're diagnosing it more and more now. Why are they diagnosing it? In my opinion, is because they don't know what else to talk about. They don't know what the hell they're supposed to diagnose. So they got to put something up there. So they see mast cells at high levels and say, got a mast cell activation problem. Well, yeah, you do, but it doesn't tell you why and why it's becoming so reactive. If you're going to fix anything, you got to find out why. You have to fix the underlying situation. So if you have these too many mast cells and they accumulate in tissue, and if that's really what they're doing, they trigger similar type of allergic responses, then why do they get so bad in the springtime? What makes the springtime initiate a worse response for these supposed mast cell pieces? Well, let me tell you why. We go through the wintertime, and in the winter, what don't we have? We don't have normal sleep cycles because the nights are way too long. We're not bears that need to hibernate. We need to rest. We calm things down. It's a rest and restorative phase. But we get all messed up in our get up and do the things that we need to do. We don't get any vitamin D. We get very little. If you're living in the Washington metropolitan area, in this part of the world, over 75% of people have inadequate amounts of vitamin D. And if you have dark skin, if you have other pigmentation problems, you're not stimulating the melanocytes, which are the things that produce your vitamin D. And even if you could, and you were outside, how long do you have to be outside? Well, you got to be outside with a whole lot of your body exposed for at least 45 minutes to get enough vitamin D. And then there's some people that if they get vitamin D foods and so forth, their vitamin D levels are okay if they can metabolize, if their gut's working the way it's supposed to. But again, I said 75% of all of you that are listening to me have low, inadequate vitamin D levels. And that's going to be a major, major issue. So what else do we have? Well, we went through the holidays, right? Starting about Halloween. From Halloween and Thanksgiving and the holiday season, Christmas, and all the other things that we celebrate, and going into New Year's, we do what? We shove things in our faces out of celebration that we normally wouldn't do at that level. So it's knocking our immune system down around our toenails. It's making it far worse than it should be. If that's the case, don't you think that's going to have a result? I don't know about you, but I think so. So sugars, sodas, coffee, garbage. in our system on a regular basis, suppressing body's immune response, increasing our inflammatory reaction, no vitamin D, sleep cycles that are way off, just with that. And now we're getting into what? Inability to function and do. What does that mean? That means that we sit and we tighten up and we have muscles that contract and ligaments that are not being stretched and very little circulation going through our system. Why? Why is that? Because we get into a lifestyle that, in today's world too, I'm going to add one other piece to it, is that we're sitting on our phones, we're on our iPads, we watch television. We don't even have to get up. The only thing that we get up for is we go to the kitchen to get something that we should be eating to begin with. So, my friends, think about it. I want you to think about that allergy that you have right now, that cough that you have right now, that head pressure that you have right now, the joint spaces that hurts, that muscles that are too tight. You're so tired you can't get up and move. That's not normal. It's not supposed to be that way. There's a patient that came in to see us about, I think it's about a month ago now, 6 weeks ago. And this lady was telling me that, she is miserable. And this year is the worst that she's ever had. And it's always in the springtime. And I'm looking at this woman. She's about 47, 48 years old. And she's probably about 15 pounds heavier than what she should be, even with a sliding scale. And she's inside all the time. She rarely goes outside. She goes out in the wintertime to, sweep out her driveway or something of that nature, but that's about it. She does a little housework. She's in about 1,800 square foot home. But now she wants to get outside and start doing things, but as soon as she went outside, the pollens just knock her right down. And she said, well, she was told that she had rheumatoid arthritis and she had a mast cell problem. Combination of two things, right? Interesting. So we did our thing. We examined her and we put her through our normal testing, which lasts about an hour and a half, by the way. And we checked her energetic field. We checked her neurological system. We checked her levels of zinc, which if your zinc levels are too low, you have no immunological response. And the majority of you have no zinc in your body or very little zinc. We checked her oral pH, acid alkaline level. We did postural pressures. That means that we take it when you're sitting, we take it immediately when you're lying down, and we take it when you stand up, and we look for the fluctuations in that. And then we do consultation, examination process. That's very different. So what do we find? Well, we found that her fight-flight system, that her adrenal system, and how did we know that? That was not working the way it's supposed to. When she stood up, her blood pressure dropped, and she had all the correlating symptoms. Her eyes hurt when she went outside and looked at the sun. She got up too quickly. She got very, very dizzy. She turned her head too fast. She got dizzy. She reached down and picked something up, and she'd hurt for the rest of the day. It doesn't have to be severe, but it's there. So all these things are check, check, check. Why is that important? Because it tells you that your primary anti-inflammatory pathway, your adrenal system, the outer shell of it, is not working the way it should work. So subsequently, she is suffering the consequences of one of the primary immune responses in her body. And that's why she's hurting. That's why her joints are swollen. That's why she hates the spring. And she always gets in trouble this time of the year. Look, we talked about mast cell activation, and I'm bringing all this in, not to get into mast cells deeply, because we'd spend probably the next couple hours doing that. But mast cell problems are not necessarily the culprit. They're the end product of other things not working. They're the end product of the fight-flight system, the adrenal system, not functioning the way it's supposed to. They're the end product of your inability to digest and break down your primary immunological system. They're the end product of your body being beat up so you can't fight viral patterns anymore. And so you become more susceptible to what? things like MS, things like Epstein-Barr virus, things like cytomegalovirus, things like what? Things like even HIV. By the way, did you know everything I just mentioned is a herpetic virus? Every one of them. And if you look it up, you're going to see, as I said earlier, six different kinds of herpetic processes. And there's some that say there's even more than that. So if that's the case, we better do something about it. We better fix it. Did you know that almost 100% of you, maybe 1% less, have what? Have Epstein-Barr virus as an exposure in your body, and you have an immune reaction that's holding it together. We're a society that is going down very rapidly. We're losing our immunological patterns. You know, the responses to traditional treatment, and what I'm talking about is medical immunological treatment, is nothing more than suppresses your body's already inability to control its immune response. The antihistamines, the steroids, the biologicals, and it kicks it down. Now you're dependent on the rest of your life, unless you see somebody like me that knows how to slowly walk you through the process. If you had a blow to your head and the long nerve, the longest one in your body called the vagus nerve, is not working the way it's supposed to, every organ system, every one of them is going to be problematic. They're not going to work the way they're supposed to. So why don't you take care of that pain? Why didn't you take care of that car accident before it got to this point? And now you're looking at climate problems. You know, you're not stable when you go outside anymore. That's an interesting terminology that I just used. You're seeing highs and lows in humidity. You're seeing coldness and hotness. These are generally the things that, if they're stable, if you're in the sunlight and it's clear skies, that will help upregulate your immune system. But extreme hot, extreme cold, flare-ups that occur because of exposures further kick your immune system. It's not just the symptom, but they knock it down even more. So I don't know about you, but I'm trying to figure out how I can continue to be more than. And we have to look at these seasonal disorders. We have to look at the rheumatoid that flares up as we get close to the end of the wintertime, the psoriasis that gets worse during the wintertime, the sclerosis, the hardening, if you will. MS is one of them we talked about that seems to get worse in the spring and the summer. The seasonal light disorder problems that show up. Look, there's ways of managing this. When you join us on the 15th at the Roselle Center for Healing in Fairfax, we're going to go through this. I'm going to show you exactly what to do. I'm going to show you signs and symptoms on your body that tells me that you're headed for trouble. So join us. You can call 703-698-7117 or go online at rosellecare.com or drtomroselle.com. And by the way, I want to remind you, if you're not following me on social media, if you're not following me on all the outreaches I do, make sure you do it, because I'm just going to continue giving you tons of data, things that you can use, very specific applications. And when we come back after the break, we got one coming up in about a minute, I'm going to tell you what I told you. I'm going to tell you things that you can do now to make a difference. Things that you can really get your life together with, whether you ever see me or not, except for listening to me on the radio and watch me on podcast. Things that can really restore your health, get you a heck of a lot better than where you are right now. I think we all deserve to live well, right? I think we all need to look forward to the future. But if we don't have that, then why is life even worth living? Seasonality autoimmune conditions are significant. And a lot of them start with just getting enough vitamin D and getting rid of the junk that you constantly put in your body. Look, I'm here to give you data. That's why we call it Ageless Health, because you deserve the information. We're coming up to that break. Don't go away. I'm going to give you some much more applicable things. I'm going to revamp everything that we just said. things that you can do right now. You're listening to Ageless Health. This is Dr. Tom. I'll be back. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use. So I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. This is Ageless Health with yours truly, Dr. Tom. Thanks for sticking with me. I want to give you some information that is yours to apply, okay? We're talking about autoimmune reactions as a result of seasonal shifts and changes. So we're talking about springtime and why so many of you right now are hurting. Your joints are swollen. You can't breathe really well. And, your head's all jammed up. You can't think the way you're meant to think. Rashes all over your body. And you wonder why. Why is it that I get to suffer like this? I never had this before. Now I have this before, ongoingly. Well, at the end of the day, it's not something that took place simply because you were being picked on. We have this thing called epigenetic impact to your environment. Your environment is you. It's your physiology. So if we know that environmental something affects us, and what are environmental impacts? We're talking about biochemical, bioelectrical things. We're talking about physiological things, injury patterns that we, put up with, never really resolved the way they were supposed to. And we're talking about the way your headspace works, the emotional platform, and so forth. So all the things that are around us, the plastics and the electrical fields and the stuff that they put in our waters, the drugs that we're taking, the nose dope that we put in our heads, you name it, it goes on and on and on and on. The bad foods, the sugars, the sodas, the coffee, the drill. And then the stress patterns, the things we don't make decisions upon, and the limping around that we do and say, what do I expect from my age? Those are epigenetic environmental inputs. And some we can't control because we have a whole lot of stuff that's being done to us, my opinion, and demanded of us that we are falling and agreeing to. So, having said that, what can you do? What have I told you already today that can make a difference in your life? Well, we said that one of the primary movers is enough vitamin D. Don't go out to some of these five and dimes and drugstores and get vitamin D. Go to a health food store. And you want to get enough vitamin D in you that you want to get that vitamin D level up well over 50 on a blood test. So some of you need to take 5,000 a day, and that'll get up over the top of it. Some of you are going to need a lot more than that, 10,000 a day. Most of us living in this area will need around 10,000 a day. Some of you can get away with 2,000 or 3,000, and you'll get it up that level. But I want to encourage you that the functional medicine parameter on a blood test is not 100 at the top level. It actually goes up to 150. And if that's the case, we need to really encourage you to really get to talk to somebody that knows what they're dealing with. We got a great nutrition department, by the way, here at the Roselle Center for Healing. We have two new people. One that has been in place, her name is Keisha Henry. If you'd like to just do a nutritional consult, when would now be a really good time to call in and make that happen? She's amazing. She'll evaluate that. We do a lot of that with our patients on an ongoing basis as part of the treatment program. Don't forget that you can talk to any of our doctors and get some directive with a free 20-minute consultation. You don't have to pay for it. It's called free, right? Give us a call. So when those things are available to you, take advantage of it. So a little bit of vitamin D. What else do we want to do? I would encourage you to go to as much natural organic as you possibly can. Stay out of the middle of the grocery store with all the boxes and all the preserved things. If you look at the sidebar and it looks like a chemistry set, don't touch it. How about high levels of vitamin C? What does that do? And how much am I talking about? Minimally about 1,500 milligrams broken up in divided dosages. It triggers something called interferon that allows you to break down viral patterns. There are other things. L-lysine. L-lysine has been around for years. It's an amino acid that is known to stop the replication of viruses, but you have to take it at pretty high levels. And so you take 1,000 milligrams. Will it give you some benefit? Yes. If you're trying to beat a problem, the levels need to go up. A lot of the research studies showed it very, very high levels. So you're not a patient, so I can't advise you that. Just know that that's part of the puzzle. We've talked about quercetin. And if you have a stuffy head and you know that's all it is and it's just an allergy reaction, it'll make it happen. We talked about digestive enzymes. And if you have a bad gut and you're not taking digestive enzymes, it's good. Bad gut's going to get worse. Pancreatic enzymes. You know that pancreatic exocrine insufficiency, whatever they're calling it now. Your functional medicine people have been dealing with that for decades and decades. We know that it exists. Drug companies just try to figure out how to make a profit out of it. A lot of your companies, your good nutrition companies, are being bought out by the drug companies. Why? Because you guys are trying to take control of your health and they're losing money. So they want to make money any way that they possibly can. Yes, I said that. And they're not going to like me for the things that I tell you, but that happens to be the truth. It happens to be true. Prove me wrong. Prove me wrong. There's so much you can do to make a difference. Get off your butts and get a little exercise. Do some chair yoga. Do some chair tai chi. You know, if you want to go outside, say, oh, I can't, I die. Well, you know, this is the only time I would ever tell you to wear a surgical mask. I'm not going to tell you to, because it doesn't stop viruses, but it stops the big particles called pollen and all the silliness that's out there. Start getting sleep on a regular basis. Go to bed at the same time. Turn off the stupid tube. Relax. Go to bed. Get up. Start quietly in the morning when you get out of bed and you acknowledge your creator and do a little kind of, you know, meditation on the things that you believe on and look at it as a positive thing. Get a big glass of water. You know, start your day with about 12 ounces of filtered water, not the garbage that some of you drink. Stay away from the coffee and the teas. Then after you drink your water, then that's when you do your yoga. That's when you do your little tai chi. That's when you do a little gentle movement around for about 10 minutes, but you do it every day. And when you get outside, go for that walk. Don't go too far. You know, do 5 minutes out, 5 minutes back. Get that body to move. Start moving, you know, getting a little blood flow, if you will. I gave you a lot of little things to do. If you just did those things and you got rid of the sugars, the sodas, the coffee, the black teas, the fast food, the fried foods, the alcohol, the gluten, the additives, the GMO products, just doing that with a little exercise, adding some basic nutrients like D and C and zinc and quercetin and so forth, just doing that, you will get better. But you got to be proactive. You have to take the initiative to change you. You have to. If you don't do it, if you don't know what to do, or you know that you got structural problems as well, you need somebody to really walk you through the allergy patterns, call and make an appointment with one of our doctors, but at least mentally join us on the 15th, March 15th, 6 p.m., the Roselle Center for Healing in Fairfax. We're going to go through a lot of different things. And by the way, for those of you who are not patients of ours, if you go to our website, you go to rosellecare.com and you go to Ageless Health Store, and there's you click down. There's a way of getting nutrients that we recommend. There's a lot of other stuff in there. But April the 15th, 6 p.m., Roselle Center for Healing, Fairfax, Virginia. Call us. Register for the class. Make sure you show up. And if you can't make it, what do I want you to do? I want you to call and say, hey, the day before, I can't make it. That way we can put somebody else in that spot, okay? It's a freebie to you. And by the way, I want to remind you, again, that we are ongoingly associated with a Virginia-based 501c3 called what? Called Caring for Others. All of our doctors are signed up to do free hours to support the community in lectures. And if you'd like to have us come talk to any of your organizations, your church groups, your parent groups, the school groups, on any subject relative to health, one of us will do it, including yours truly. I have to do so many hours a year, and I enjoy that because it's important that all of you have the data. So it doesn't make any difference what it is. It could be on something simple as eat right for your type. You know, do what you need to get done, right? All you have to do is call us 703-698-7117, or you can do it through the website. Go to caringforothers.com. And one way or the other, we're there for you. Listen, this program often is, you know, like drinking from a water hose. I understand that. But we'll respond to you. We'll answer your questions. Send me a note. Tell me what you want to hear. Glad to do it for you. But make sure that you tell your friends about this, because this is an important program. This is one that gives you data, information, ongoing. We're going to come up. We're going to start having some guests on the program with us. We're going to give you more and more information. If you need to know how to apply it, let us know. We're happy to do whatever it takes to give you the data, the information ongoingly that will make you ageless in your health. We're here every Saturday giving you Ageless Health tips, information, guidelines, things that you can use for you and your family. That's the important piece. You and your family. You know, those of you who are aware, pay attention to Bob Kennedy's group, but look behind the scenes, see what's being done. There's a lot of things that you need to know about. Don't set it aside. There's a movie online called Vaxxed, V-A-X-X, apostrophe D, Vaxxed, and you can get it on YouTube. Listen and watch it. I promise you it'll give you a different insight that you never thought about. There was a guy by the name of Del Bigtree, who was a producer-director for a cable television program called Doctors. He's on it. Watch it. I promise you, you're going to walk away differently. We're coming up to the end of the program. We're here for you every Saturday morning with a different topic, a different situation. Remember, for one reason only. I love you all. You have a great day. Take care. We'll see you soon.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be kinder to one another. It should feel like heaven to make another's day. It should feel like heaven to live a better way. It feels like heaven to be